아, 안녕하세요. 매일매일 운동하기를 실천하고 있는 동탄 왕코입니다. 날씨가 엄청 추워졌어요. 야간 출근하는데 추워가지고 와 깜짝 놀랐어요. 패딩을 꺼내서 입어도 될 정도로 날씨가 많이 추워졌어요. 지금 이제 해가 뜨고 있습니다. 야간 끝나고 왔는데 잠을 푹 자면은 일하는 동안에는 안 힘들어요. 피곤함이 좀 덜하고. 근데 이제 퇴근해서 와 갑자기 한 번에 확 몰려옵니다. 그렇다고도 지금 자다가 이따가 일어나서 할 수 있을지도 정확히 모르고. 그래서 지금 일단은 팔굽혀펴기랑 스트레칭이랑 팔굽혀펴기랑 윗몸 일으키기 좀 하면서 영상을 찍도록 하겠습니다. 으아. 오늘 진짜 확진자가 100명이 넘었는데
and repeatedly
다음
lied
주에 영화관 가려고
about the
그랬는데
state of this pandemic.
언제 가야
We
될지
saw him
모르겠어요.
refuse to take responsibility. If this is a success, what's a failure look like? We're more than 8 months into this crisis, and the president still doesn't have a plan. He's given up. He's quit on you. He's quit on your family. He's quit on America.
Voters tonight have two polar opposite choices that became even clearer on that final debate stage last night.
We're about to go into a dark winter, and he has no clear plan.
Does she
I
have
don't
no
think we're
plan?
going to have a dark winter at all. We're opening up our country. I say we're learning to live with it.
People are learning to die with it.
I'm going to speak momentarily with the nation's top infectious disease doctor, Anthony Fauci. But first, I want to go to the two campaigns tonight. Arlette Saenz is covering the Biden campaign. Caitlin Collins out front at the president's rally tonight at the Villages. Let me start with you, Arlette, though. Vice President Biden today laying out new details of his plan to combat the virus. What did he say?
Well, Aaron, it's very clear that Joe Biden is trying to keep the coronavirus pandemic front and center in these closing days of this campaign. The former vice president arguing that President Trump is ignoring the realities of the state of the pandemic right now in this country, and also arguing that the number of deaths due to COVID-19 show that the president is ill-equipped, that he didn't develop a sufficient plan. So what you heard from Joe Biden today in a speech in Wilmington, Delaware, was starting to lay out some of that strategy of what he would do in office if he's elected. Now, one of those things Biden said is he's not going to wait till he's in the White House to get started working on this pandemic. He said that during the transition, he would begin reaching out to governors, Republicans and Democrats, to gauge what kind of resources they need to combat the pandemic. He also said that he would call on Congress to put a bill on his desk by the end of January to provide the resources for public health and economic initiatives, a contrast to the current state of play in Washington right now as negotiations are tied up over that COVID relief bill. Biden also talked about the need for Americans to wear masks, saying that it's not a political statement, that it's something that people need to do to curb the spread of the virus and consider the other people that are around them. Biden has acknowledged that he can't implement a nationwide mask mandate, but he said he would go to the governors asking them to do so, and if the governors did not do that in their states, he would then take that to the mayors and local officials. Biden here in these closing days of the campaign is really believes that he can hone in on the COVID-19 crisis as well as the economy. His advisors believe this is the defining issue of the campaign, and that voters will ultimately believe that the president's mishandling of the pandemic will be a reason to vote for Biden in the coming weeks as the election winds down.
All right, Arlette, thank you. And I want to go now to Caitlin. She's in Florida, as I mentioned, with the president. And Caitlin, I mean, the two visions here could not be more starkly different. A very different picture from Donald Trump tonight.
Yeah, they couldn't be more different. You heard it last night, but Aaron, we're seeing it today. The difference in these events that Joe Biden and President Trump are halting. And so that's the question that ultimately pans out here, because what the president was saying last night, mocking Joe Biden for saying that we're going to have a dark winter ahead, something that medical experts have said as well. The president repeated that here today. And let me remind people, this is what this rally would have looked like, Aaron, if they had held it a year ago, before there was a pandemic, before anyone knew what coronavirus was. Because it's not just mask wearing, which is what we talk about so often with the president's rallies, and we saw few and far between here today, but also the social distancing. There is no social distancing here, and this is a retirement community, a massive one, and everyone is seated next to each other. And yes, we are outdoors, which medical experts say helps, but we saw how that played with the Rose Garden event and how it can still spread even if you're outdoors, if no one is wearing a mask and they think they're protected when they're not, and they're certainly not social distancing. And so the president was here, Aaron, to try to shore up his support with seniors, something that he has been hurting with, and of course is what helped him carry him to the White House in 2016. And of course, he's got these people who attended this rally wearing Trump shirts on his side. But the question is, what about those vulnerable seniors who are worried about COVID, who are worried about what's going to happen? Did the president win any votes over by holding rallies like that? That's the big question for the Trump campaign that they're going to find out in about 11 days.
Absolutely a crucial question, because they need those votes to win. Thank you, Caitlin. And just to be clear, here is where things stand in this country right now. More than 223,000 Americans are dead. 32 states tonight showing upward trends in new cases. Only one state in the entire country is on a downward swing. The daily case count in the United States topping 70,000. And we don't even have today's numbers, so I'll give you yesterday's. The count then was the fourth highest day of cases overall since the pandemic began. Today, we are already over 65,000, so we're on track for another near record. 12 states seeing their highest 7-day averages for new daily cases yesterday, and the 7-day average of deaths continues to climb. Now it's 763, which is the highest level of average weekly deaths in a month. Hospitalizations also on the rise. 41,010 Americans reported hospitalized with COVID on Thursday. Out front now, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. And Dr. Fauci, I appreciate your time. We look at these numbers and they're sobering. And, there's been this chart out there that has been deeply concerning, comparing the U.S. to Europe. And, you know this well. I'll put it up for everyone to see. Europe, a couple weeks ahead of the U.S. at the beginning, right? We saw the surge, and then there and then here. The numbers there came down then significantly, but that never really happened here, right? We always were at a much higher plateau. Now in Europe, a super spike in cases well ahead of what we're seeing here in the United States. Are you concerned that we could be about to follow suit with a massive spike?
Yeah. Aaron, I am concerned about that. And the reason I'm concerned is the numbers that you gave, our baseline is really quite high. If we hang around 50, 60, 70,000 and we're there, that's the reflection of community spread. And then as you look at the map of the country, you see more than 30 states are having upticks in test positivity, which is a pretty good predictor that you're going to have a surge in cases, which will lead to surge in hospitalizations. The reason I'm particularly concerned, as we get deeper into the cooler months of the fall and the colder months of the winter, that activities out of necessity are going to have to be done indoors. And that's going to be a problem. So that's the reason why I say we really need to double down on the kind of public health measures that we've been talking about so long. And I don't mean shutting down the country, Aaron, because whenever I talk about amplifying and just stressing the public health measures, people think that means we're going to shut down. It doesn't mean that. It means there are some fundamental things that you can do. Universal mask wearing, keeping a distance, avoiding congregate and crowded sections, particularly indoors, and wash your hands as often as you possibly can. They sound very simple, but we're not uniformly doing that. And that's one of the reasons why we're seeing these surges. We can control them without shutting down the country. And we've got to pay particular attention now, particularly these congregate settings indoor more than outdoor, that we will lose control over it if we don't do that. So that's the reason why, as much as I can, essentially plead with the American public to please take these things seriously, we can turn it around.
There is a new study, Dr. Fauci, from Columbia University, and it had a big range, but a horrifying range. 130,000 to 210,000 Americans would be alive if we had had a stronger response to the virus, right? Up to 94% of the people who have died in this country could still be alive if we had done some of the things you just mentioned, national mask mandates. They also cite the insufficient testing response early on and delayed overall response. Some of the reasons that they think these deaths could have been prevented. Like I said, it is a stunning study to read. Do you think that that many lives could have been saved by those simple but fundamental things?
You know, Aaron, I don't want to put a number on it because, you know, that's a model study, but I feel quite confident that if we had uniformly done the things that I was talking about just a moment ago, that certainly considerable number of lives could have been saved. You know, remember back when we were having the daily press conferences at the White House, and I was saying when we were talking about opening up the economy and opening up the country again, we had the gateway, the phase 1, the phase 2, the phase 3, and I emphasized that it's not going to be an all or none phenomenon. It's not like turning a light switch on or off. It can't be that you can go from being relatively locked down to just opening up and just not worrying about anything. You've got to do it in a graded fashion, and a graded fashion means you abide by the guidelines, but you do it with some fundamental common denominators. And that's what I refer those 5 things to. They're almost like minimal common denominators that we've got to do. And we've got to do it across the board. We can't be having some not doing it at all and others adhering to it. Otherwise, lives likely could have been saved if we had done it that way. But it's not too late. I mean, that's the point I want to make. I don't like we throw up our hands and say, well, this was terrible. We can turn it around. We can.
So we can by doing those things. We know what you're talking about, though, some of your concern about what we're seeing in Europe and whether that could happen here is obviously inconsistent with what the president is saying. I don't need to tell you that, but he did just speak moments ago at a rally, and here's what he said.
We're going to quickly end this pandemic, this horrible plague that came in from China. You look at what's going on, and we're rounding the turn, we're rounding the corner, we're rounding the corner beautifully.
Dr. Fauci, do you agree?
Well, if you look at the numbers, Aaron, it tells us that we really are facing a very challenging situation. And if we don't do something in the sense of paying stricter attention to the kinds of public health mitigation issues that we were talking about, it's not going to spontaneously turn around. The good news on the horizon is that vaccines look promising. And hopefully by the time we get to the end of November, the beginning of December, we will have shown that we have at least 1 or 2, and maybe more, but at least 2 vaccines that are safe and effective. That's going to be an important issue. But from the public health standpoint, if you look at the numbers of the daily infections, the upticks on the map of more than 30 states that are having upticks, it's not going to spontaneously turn around unless we do something about it. We don't want to throw our hands up and give up. That's ridiculous to do that. But on the other hand, we don't want to just say that nothing can happen. We have control of this. We can do things that could turn that around.
So I understand, you don't want to wade into politics, but masks are not political, right? They shouldn't be political, right? And we know we see the president at these rallies and people don't wear masks. And Joe Biden does have a really different plan, right? And today he talked about it, and he specifically talked about making mask wearing mandatory. Here's how he put it.
First, I'll go to every governor, urge them to mandate mask wearing in their states. And if they refuse, I'll go to the mayors and county executives and get local masking requirements in place nationwide.
He also wants to make masks mandatory, federal buildings, interstate transportation. Do you think this is a good idea? Is this what a president of the United States would be helpful if they were doing, fighting for mask mandates?
Well, you know, one of the issues that people that talk about mandating not be a good idea, because then they'll say they have to enforce it, and there's going to be a difficulty enforcing it. But if everyone agrees that this is something that's important, and they mandate it, and everybody pulls together and say, you know, we're going to mandate it, but let's just do it. I think that would be a great idea to have everybody do it uniformly. One of the issues, though, I get the argument, say, well, if you mandate a mask, then you're going to have to enforce it, and that'll create more of a problem. Well, if people are not wearing masks, then maybe we should be mandating it.
So in other words, but it sounds like what you're saying is sort of the power of the comments. But you're going to have some people who don't wear them. You only need to have a certain amount, and a mandate could get you there.
Right.
Even if you don't have enforcement, right?
Right.
So
Right, exactly.
okay, so when you mentioned the vaccine, and I know you spent a lot of time on that, and you also spent a lot of time on therapies, a considerable amount of time, right? And the president did just speak about that as well, right? And his own experience recovering from the virus in the debate last night. Let me just play it again.
I can tell you from personal experience that I was in the hospital, I had it, and I got better. And I will tell you that I had something that they gave me, a therapeutic, I guess they would call it. Some people could say it was a cure.
Okay, cure is a really big word, and it's a word that all
파급하게
of us
20개만
can
하고
actually relate to.
끝내겠습니다.
I know you've talked about that antibody cocktail that he received as possibly being
힘들어서
effective,
못하기보다는
in his case.
너무 하기 싫어요.
Would you call that, though, a cure?
You know, it's semantics, Aaron. It really is. I mean, when you talk about a cure, you're talking about something that if you don't intervene, it's not going to get better by itself. Many of these cases spontaneously recover without any intervention. So when we intervene and a person gets better, I would rather say it hastened or improved greatly their recovery. Because cure means that, for example, you have cancer and you give someone chemotherapy,